Good evening, everybody, and welcome to this evening's meeting of Staffing Matters and Urgency. I'm Councillor Claire Douglas and I'm the chair this evening. So as we go straight through to the agenda, first of all, have apologies. We have no apologies this evening. First item on the official agenda is declarations of interest. Does anybody have any declarations to make? No declarations of interest. Second item is exclusion of press and public, and that's to consider excluding the press and public from the meeting during the consideration of annexes A to D on agenda item 7, which is redundancy, retirement and settlement agreements, on the grounds that they contain information relating to individuals and the financial affairs of particular persons. Can I see those who were in agreement with us excluding press and public at that point? Yeah, so that's unanimous. So we will exclude people at that point. Councillor Kilbane, you want to say something?
Yeah, thanks, Chair. Can I move that we take item 7 as the final piece of business so that we don't have members of the public waiting and then coming back in?
Yeah, absolutely. So we'll take that at the end, and we'll also do a very brief introduction to the paper by Helen so that the public know what it's about, and then we'll exclude press and public and talk about it in private session, and then the meeting will come to an end at that point. So everybody okay with that? Yeah, okay, thank you. Our next item then, I seem to have lost half of my agenda. What's going on there? I've lost text on my computer, which is not very helpful. Thank you. Thanks. Item 3 is the minutes of the last meeting. Does anybody have any objections to accepting those? No, it's a fair and accurate reflection of the meeting, so I'll sign those before we leave. So those are approved as well. Thank you, everybody. And then item 4 is public participation, and today we have nobody registered for public participation. All right, and finally then moving on to the substantive matters, item 5 is the proposed new chief officer structure. Ian, do you want to start with that? Thank you.
Just before I start the report.
Mike.
Yes, just before I start the report, it's just a slight change I want to make to the recommendations, and I'll explain as I go along just why that, but hopefully the committee will think that it just clarifies things in terms of next steps. I'd like to add a new recommendation, which is to say the following, which is to agree that prior to implementation, the committee will receive a further report back that will include any revisions following consultation, and will also set out to the committee any financial implications associated with potential redundancies. So that is planned to happen, but I just want to make that absolutely clear in the recommendations that there is a further report that will follow in March, which will, subject to the consultation, pick up some of the issues, but will also clearly set out in detail any financial implications. And I'll explain a little bit about that. And also, just with that added in, just to change the existing recommendations. So recommendation 1 is to delete the end part, which then says, so it's to delete from and then subject to consultation the implementation of the proposals. So we take that out. And then recommendation 5 is to delete the final sentence of recommendation 5. Again, that's taken out the bit that says if no amendments are considered necessary, the proposal will be progressed to implementation. It's just to make it very clear that there is a further report which you'll need to consider in March in detail. So turn to the report. Members be aware there was a previous saving agreed in terms of senior management. That wasn't exclusively chief officers, but I think there was an expectation that, you know, at least a significant part would come from a review of chief officers. Clearly, when you look at this sort of issue, it's not just about savings, but absolutely savings are important, particularly in the current financial climate. But also, we've got a new council plan. We need to bear that in mind. We have a new combined authority for those who are clearly at the meeting this afternoon. We have significant pressures clearly in social care, issues in terms of health and well-being, commitments in terms of affordability, equalities, climate change, and lots of major projects, particularly including York Central. So the proposals, yes, you need to clearly look at financial savings, but we need to be something that clearly can work and can try and deliver that council plan. Clearly, the report takes you through the proposal. I won't go through every last detail, but I think just to draw out some of the main issues. So in the, what I call the people services, so children, adults, public health, that essentially remains as it is. But just to note, as the paper does note, there will be a review when the new director starts of adult services, and clearly that's appropriate that we wait until that person comes in to have a look at things alongside myself. There's a proposal to create a director of finance role, so that brings some of the finance functions which currently sit elsewhere and also moves asset management to the new proposed director of finance role. And then it looks at place and communities, effectively bringing those sort of together and options around that. And I think it's important to stress clearly there are some chief officer roles we have to have. So you have to have a director of children's services, for example, you have to have a director of public health. But clearly are some that you don't have to have, and which you have options around what you can do more. And clearly that does affect, that is the case in place, communities, those sort of things are not statutory, but clearly they are important, very important issues. So the proposal brings those place and communities together. In terms of the aside from specific proposals, the report also talks about aspects in terms of layers within the organisation, and very much a commitment to look, you know, in coming years, basically at how you reduce those layers within the organisation. This takes a step at trying to do that, but there's an awful lot more work required to go down further. We do talk about clear next stage, looking at heads of service underneath there and assistant directors. And again, that will be looked at carefully in terms of opportunities to realign, to look at efficiency savings, and to look at reducing the layers in the organisation. Just want to stress that clearly this is the start. Now, there has been clearly dialogue and discussions with people to get to this point. But this paper is very much the start of the consultation, the formal consultation process. I am very much, you know, looking at hearing from people in terms of views. That's from employees, and that's not just the employees potentially affected, but also employees within the organisation, hearing from partners, and also clearly from elected members in terms of things, in terms of views, whether what they think would work, what they think might not work. And so this opportunity is an opportunity for people to have further dialogue. This is just a start of the proposal. What we will need to do, and that's why we changed the recommendation, just to make it very clear that there will need to be a further report back. That will hopefully be in the first week in March, which is your scheduled next meeting. That fits nicely in terms of the likely consultation period to then report back with any options, amendments to the proposals, and then also to set out very clearly the financial implications of those proposals. And in that regard, I think you need to be very clear that this isn't just, it's not simply a case of you take a post out and you save all of that money. Redundancies can be expensive, and clearly we'll need to set that out in the next paper for members' consideration. And clearly redundancies are particularly expensive for anyone who is over 55, because that triggers, the redundancy triggers the access to the pension. And at that point, there is a pension strain, and that can be a significant cost. And it's a cost which potentially is getting higher in respect of the career average scheme, which effectively assumes people are going to work till 67 now. So that will need to be set out to you, and therefore there is clearly a significant decision for you to potentially make in March, which is to weigh those issues in terms of potential savings, but also what other issues in terms of redundancy and pension strain. And that's what I say, this starts it. We will come back with full details and feedback on the consultation. I'll stop there. Obviously, happy to take any questions.
Thank you, Ian. Does anybody have any questions for Ian at all? Councillor Eyre?
Thank you, Chair. I've got 3 questions and then some general comments that are happy for you to do with them, whichever way. The first question was around the changes to the assistant director description to senior managers 1, 2 and 3. Does it happen elsewhere? I'm used to a director AD structure. I haven't seen a director senior management structure. I just wondered if it was common elsewhere.
I think partly the reality is everybody has a slightly different system. North Yorkshire do have a senior manager layer. They specifically do design it. That's the nearest to voting, so that's the one I'm aware of. They do, though, have an AD thing as well as that. But there's nothing to stop you bringing those together and effectively calling them the same one. So I think everybody probably has slightly different ones, but I'm happy to, for colleagues in HR, if they want to elaborate on that.
Helen?
There's no hard and fast rules to the chief officer kind of layers or what they're called either. You can designate chief officers within the chief officer's terms and conditions. In terms of the senior manager role, that's something that leads also do. In some directorates, they have just senior managers, and then other directorates, they have assistant directors. It's perceived a little bit to be old-fashioned at the moment in terms of assistant directors, especially when there isn't a director immediately above them in terms of that role. So it is about, but it's a preference exercise, and it's also helping with some recruitment purposes in terms of what people are called. So to be seen as senior. Yeah. Yeah. Anything else, Councillor?
The second one was around, so there are also changes to the roles and responsibilities of the Director of Governance and HR and Business Support, but there is no mention of financial changes. So I think one of them gets more direct reports, one of them gets less direct reports. Does that mean there are no changes to those salary structures, role positions, etc.?
One of them.
I know, that's why it's a bit awkward. Don't be listening on the webcast either.
We should say that Helen Whiting, head of HR, has just left the room while this question's answered.
Yeah, so the issue with all of the roles is they'll need to go through a full assessment in terms of their job evaluation. That hasn't happened yet. We have done indicative ones for the ones who are current chief officers. Helen is not a chief officer, so that would need to go through a different process separately. But we have done that in terms of what I'd call, and Claire knows more about this than me, in terms of pencil score, which isn't the full thing, but you can generally score it. And the governance one stays where it is at that point in time. And just a bit of clarity, when we advertised the governance one some time ago, when Janie Berry got the role that she came for was effectively the same as what the proposed role. So she came for a role which didn't have the difference is the policy and comms bit which is moving. So when Janie came and this role was scored at that point in time, that role didn't have policy and comms. So in effect, it's gone back to what the original proposal around that role was, and the scoring, which I think, lose track of the years, but I think that goes back to sort of 3 or 4 years ago. And that's, as I say, so the director of governance role had that policy added. It's now removed it, but clearly having previously scored it as it was, we wouldn't expect it to change.
So in a nutshell, that one's likely to stay the same. The other one might go up after
Yeah, the one could potentially, but we haven't done that.
And I think Claire would like to add something to that.
Yeah, thank you. Just very briefly, I mean, all the work that's been done so far is very loose in terms of where it's at. They have not had a proper scoring. They can't until consultation goes through, and people have got an opportunity to input on those. Just in relation to the governance role, the changes are so minor, excuse me, that it wouldn't necessarily affect it, because the scoring method for chief officers is different scoring method to other greater than the organisation. So the Hay scoring, in terms of the breadth of the factors that need to go there wouldn't be a significant enough change for that to alter. But of course, that's subject to all of the conversations we've got to have with everybody that's in scope.
Thank you, Claire. Councillor?
I should want to get Helen back. My last question is not about Helen.
We wait for Helen Whiting to come back now. Right,
So-
please go ahead.
The last question, I suppose, about timing. So obviously things you've said now in terms of another paper going back in March has pushed it even further back. It was always stage 2. We don't have the adults in here for the reasons that you quite rightly said, that we don't have a director in place to do that. Given that, and given we're now coming back to March, what scope is there actually of rolling phase 1 and phase 2 in together and actually getting a comprehensive structure all the way down, rather than doing it a bit at a time?
Probably not, just because it becomes a much bigger, it's just a big exercise, and there's an element of trying to get the relevant directors into their roles at stage 1, and then to let those directors have an influence in terms of the shape of their structure underneath them. I think that's right. What is possible is it's not two, if you like, completely distinct processes. When the first thing, going to March doesn't particularly delay anything, because we have to do basically 30 days anyway. We'd have to consider it. But also we have to bring back the financial implications to you. That we have to absolutely set that out to you. So, you know, that just is what the process is. I would like to get the director roles appointed before we do stage 2. But that doesn't mean that you have to do stage 2 in its what it's called entirety and wait for every last thing of stage 1. So, for example, if this proposal went forward and was agreed, there are some director roles which do not change. So actually, once you've got the director, and a number of them, you've got them. So in director children's, it doesn't change. So we can move to stage 2 for children's straight away, effectively. You'd better do stage 2 for children's on the basis that actually their roles are so distinct to others. So if you're doing something in place or communities, they're not going to be impacted by children's. So we should be able to move forward with it fairly quickly, because most directors will be staying in their roles. It's in a couple of particular cases where clearly I'd like to go through that process so that those people can help influence and shape those roles. And actually the structure underneath those may in part be determined by who actually gets those roles as well.
Thank you. Councillor Widdowson?
I've got questions, observations. The area that seems to be most impacted is going to be place, because we're moving it around. What confidence can you give that the way that place is currently always on budget and does deliver, if not under budget and does deliver, how can you make sure that is actually going to go across to the other directorates, because when you look at the financial side of the other directorates, they don't have that same level of discipline.
Yeah, I'm not sure I would categorise it as simply as you put that, just because children's and adults are under extreme pressure. They're extremely complicated areas of service, and it hasn't always been the case that those areas are always underspent, and there are some reasons why potentially they do sometimes get the benefit, for example, of car parking income. That has been a significant factor in terms of them of late. We clearly, you need to try and ensure that you, in any structure, given our financial position, that we try and find some savings. That's important. That we try and make it as strong and robust as possible to deal with the issues. But there will always be an element where actually the further you push the financial savings, the more potential risk you are taking on some of those issues. But what I think you do have to bear in mind is that given where we're at, and where, if you look at most local authorities and where they think they might be, you clearly have statutory functions that you have to do. And, more and more, I suspect our focus is going to be on the statutory things we have to do. And there are some significant choices about actually the non-statutory in the level to which the council can afford to do some of those functions as well. The next stage, if that was if this is accepted, the next stage, stage 2, would need to consider some of the issues in terms of what you put in place underneath those directors. And as the report says, we'd seek to do that by making savings elsewhere, but there are 1 or 2 adjustments I think that potentially we might need to make within this direct support to directors to actually just ensure that clearly the service is run efficiently and effectively.
I think we're both agreeing. My concern is that I can see how the services inside of place have always I've only got 4.5 years experience in. Every time they've delivered on budget and they've done most of the delivery. And it's just making sure that when that is disseminated to other areas, that discipline is kept. So that is my concern. And they do have a very thin management structure. So that is a big concern in my head, that it goes somewhere else and we lose that level of discipline. So you've obviously recognised that.
Yeah.
I'm assuming that you will put things in place.
Yeah, you would have to look at the structure underneath the directors. And I'm not saying what that would be, because that's prejudging the process in terms of how we would engage with people. But clearly, in terms of those, shall I call it the 2 directors, which are covering place and communities, we would have to look at that next tiers or levels in terms of making sure that that director is able to fulfil their responsibility.
And then the other question, is it okay to carry on?
Yeah, please go ahead.
Then the other question I had is just looking, I don't know all the work, right? So when I've been involved in reorganisations before, what you normally do is you put all the work out on the table, you decide roughly what's going on, you involve different people, you don't just do it from the top, or you don't just do it from the bottom. It can be, you guys will know this way better than I do. I've only been involved in it, in how it's organised. One of the areas that jumped out for me is climate. And I would have expected that to be with transport and housing, because that's where it had a much, much bigger impact than it does where it's currently placed. So I'm assuming that these are suggestions at the moment and that they're not fixed in stone.
This is a proposal for consultation. Which hopefully I explained that, at the beginning, we have to do consultation. I'm certainly open to ideas and options around things. And as I say, that's where it's employees, elected members, staff. We will absolutely, there's no point having consultation if we're not prepared to listen to things, and then we'll bring that back in terms of that. And so, we're trying to do it in an open, transparent process. On the issue of climate, absolutely. It's hugely important. And the council plan in many ways has made it even more important. I've left it, shall I say, in this sort of policy area at the moment, because 1, I think actually it's been incredibly successful, that that role, they've achieved fantastic things up to now. You know, and the individuals concerned have done some fantastic things. And in as recently as last week, there was a presentation they did to a wider audience, and everybody really just recognised how much had been achieved on climate. We are doing really well.
Yeah.
And a bit about, you're absolutely right, it has impact in certain areas. And yes, please, you know, it is an option. I'm not saying you couldn't do it. The bit for me is actually I want it to be about the whole organisation. And sometimes if you put something in a transport, it becomes seen as transport's issue as opposed to it being actually about the whole of the organisation. And I think placing it as an activity which is linked to policy in our communities can push that through all areas. But I'm not sitting here saying that
That's fine.
proposal
I would
couldn't work.
just urge you to definitely talk to that area, because
Yeah.
they've got some distinct thoughts on it.
Yeah.
And my final just ask is, are we really making sure that everybody sees this as a consultation? Because the amount of noise that even in the last few days I've received on this is really quite high.
I'm not sure I can say that it is consultation anymore. I mean, you know,
Okay.
I have kept saying it's consultation. I've kept saying it's in here, it's an import. It's what I'm saying. It will be in the formal messages that go out. We're doing
Okay.
staff session tomorrow. It'll just be briefly mentioned, but we will talk about the fact it is consultation. If anyone has ideas, more than willing to hear them.
Thank you. Anything else that you'd like to ask about at this point? No, you're okay. Okay, all right. Right, so can I point everybody then to the recommendations that are on page 9 and 10? And we will consider those. So there's a number of them. And the first one is to approve the new chief officer structure set out within Annex A, noting that it's for consultation and to progress to that consultation. To a second one, to approve specifically as part of the new structure, the deletion of the 5 posts that are listed on page 9. Recommendation number 3 is to approve the creation of the 3 posts that are listed at the top of page 10. 4, to agree to a chief officer appointment panel for any roles that require a form of assessment. 5, to approve that the proposed structure will be subject to consultation, and should further amendments or options be proposed, that they will come back to the committee. And there we have that amendment to the recommendation that you recommended at the beginning of the meeting, Ian.
Yeah, the additional recommendation is as follows: to agree that prior to implementation, the committee will receive a further report back that will include any revisions following consultation, and will also set out to the committee any financial implications associated with potential redundancies.
So that final sentence on recommendation 5 needs to be reflect that as well, doesn't it? 6 is to note the following: to note the proposal to redefine the existing grades 12, 13 and assistant directors to senior manager levels 1, 2 and 3. That there'll be a need to strengthen management arrangements in some areas to address some of the impacts of the proposals, and to note that further reviews will be conducted across all areas of the council with a view to ensuring greater consistency of structures and ensuring optimal layers within the organisation. And to note the significant financial challenges and the structure of the council will need to adapt significantly with a view to delivering major savings in coming years. So those are our recommendations. Can I see those who are in favour of those then, please? Oh, sorry, I thought you were.
worth doing
sorry,
that
yeah,
amongst
big
it.
question to
Okay,
cover.
okay, all right.
I will,
Please
you'll be
go.
glad to know, I'll be very brief following Ian's
Yeah.
amendments to the recommendations. I think obviously we do have significant concerns about some of the structures that are in place. I have concerns about the achievability of some of the savings, but given the amendments that Ian has made and our ability to feed into that as part of the consultation, I think we can do that as part of that. So probably wouldn't support the recommendations as they are because I'm not entirely sure with 2 and 3 that I agree, but we will feed in as part of the consultation process.
Thank you. Right, can I see those in favour of moving ahead as proposed then, please? Those against? And those abstaining? Okay, so we've got 2 in favour and 2 abstaining, so that's passed. Thank you. Right, okay, thank you everybody for that. Item 6 is workforce profile report, and Helen, could you introduce that for us, please?
Can I do? Thank you, Chair. Sorry, I've got to make an apology for paragraph 4. There is a typing error. Well, it's an error. I've put in a wrong figure at the Q2 2023. That figure is currently says 2023 and it should say 2573. So apologies, that's an error. So the trend there should say increase for the headcount line. So this gives us the Q2 position, which is as at the end of September of our overall workforce profile. You may recall we've done this format for a number of meetings now, and we're given an overall trend in terms of headcount, new starters, resignations. There's not a great deal of fluctuation. Pleasing to report that the sickness absence has decreased. In terms of our new starters, they have decreased, and that's all in line with the downsizing of the organisation. The leavers have on a decrease, which is a positive, resignations and retirements. And you recall from previous conversations, we've talked about we're doing a lot of cost control measures that are put in place. I would say that our trends are decreasing are generally certainly in terms of resignations. We are in line with other national and regional figures. But despite financial challenges around the region and nationally, vacancies are still being advertised. We still have people going to be part-time and those roles are being filled in different ways, etc. But I do suspect that we will see a lot of changes about the workforce profile in the coming quarters when we're looking at them as we downsize the organisation. I've looked a little bit in more detail in terms of our age bands. Our average age for the workforce is now 46, which is a reduction of where it was previously. And this makes up actually 46% of our overall workforce as well. And this is slightly higher than the percentage figures that we had for Yorkshire and Humber in terms of the census status. When we link back to earlier conversations, when we're saying there that the age band, the biggest age band within the council, 50 to 64, that links back to what Ian was saying in terms of if we are downsizing, this is the area where we will be subject to pension costs and high redundancies more likely as well. So just to make that link over there. Sickness absence figures, pleasing to report that these have started to fall slowly. We do unfortunately have some employees who are on long-term sickness absence with terminal illness, and obviously we do continue to leave those people on our figures. That is a complete local decision. Some authorities actually remove them from their sickness absence figures. We look at the health of the organisation right across the board, and I think I've reported to you before that comparing sickness absence figures on a like-for-like basis is a really difficult thing because we don't have a generic. The LGA are looking for that, but we don't. One thing that we do have that's come in is the Chartered Institute of Personnel and Development. So the CIPD, they issued their health and wellbeing report again. This did pause over COVID. But for the public sector, we've had quoted as 10.6. The council average sits at the 11.3, which is only slightly higher. And that was a reduction of 13 days of Q2, the same time of Q2 in 2022. Again, with our colleagues in regional Yorkshire and Humber councils, again, we don't all compare like for like, but we are all reporting higher figures in social care, Absence days are steadily slowing after the pandemic, and absent rates tend to reduce in Q4. There's no rhyme or reason, but they all tend to reduce in Q4. So when we see Q4 absence levels, they tend to go down. We are comparable in terms of the reasons for absence. The CIPD report mentions about minor illness, which is equivalent to our infections, etc., and musculoskeletal and stress and mental health were the most common reasons. I've mentioned there about the LGA report and statistics, that we don't have any comparability there. One thing that the committee had asked us to look at in a little bit more detail was about retentions. So there's further details in the appendix, so the annex for you on that, and equally about the workforce profiling. We'll continue to promote the encourage our workforce to be able to actually declare their equalities profiling, so we can actually compare that with the community in terms of the census, etc. We are working with the consultant that we have got at the moment to look at equalities, and I'm working with him to look at how we can look at providing more rounded in terms of the workforce and having some different strategies. So hopefully we'll get something on that. We continue to obviously look at our workforce and recruitment opportunities, and we are looking at holding the ethnicity and disability data. We'll do the ethnicity and gender pay gap data this year, and ethnicity is a new one. So happy to take any comments on the report, Chair.
Thank you, Helen. Yeah, it's really good to see the numbers in front of us, I think, but some quite interesting trends. So I'll let Councillor Eyre and Councillor Widdowson ask your questions first, and then we'll go from there. Councillor Eyre, do you want to go first?
Just one sort of linked question, I think, probably, Helen. Page 26, paragraph 8 refers to the voluntary leavers who choose to leave the council and resign are mostly aged between 50 and 64. But the table on page 37 shows that 68% of the resignations are from 16 to 49, and the largest group is actually 35 to 49.
Yeah.
Page 37, that's the take, yeah, shows 36%. The largest one is 35 to 49 in terms of resignations.
Yeah.
Which is significantly more than.
So, and then my linked question was, in the budget, there's a suggested saving of about £600,000. In terms of, we suggested it would be not filling vacant posts as and when they become vacant. If we know that the bulk of those 68% of those vacancies will be in the age group 16 to 49, then the average age of our workforce is going to be significantly higher. So we're currently at 46%, 50 to 64. If we're not filling vacant posts and at a rate of 2 to 1, those vacant posts will be 16 to 49. Our age profile as an organisation is going to go considerably older. Okay.
Do you want to comment on that, Helen?
I think it's something obviously we'll just map, and not all, it won't be a case of if the post comes vacant, we will therefore not fill that post. Every single post gets looked at differently. And obviously we don't know what the age profile of that individual post, we're not tracking that other than the general information, but it's something we can keep looking at.
Thank you. Councillor Widdowson?
I just had a couple of observations, and they were to do with the sickness days in adults and adult more than children, because you said that both are high, but here the adult one, children's is coming down, but the adult one is stubbornly staying up, and yeah, the adult one is stubbornly high and staying that way. And then you've also got, I'm assuming that's linked with the turnover, which for both of them is more or less 20% as well. So it's just, what are your thoughts on that?
We're continuing to support, I mean, Claire actually supports adult services and may want to put some more information on this in this particular case.
Yeah, for the sickness that we've got adults at the moment, there's a significant number of people with going back to the long-term illness that are coming to the end, sadly, of processes. I think you'll see some of those dropping in time. Children's social care have put a significant amount of effort, input and support for those groups. Not saying that adults aren't doing that, but I think some of the sustained support for those staff has meant that the sickness rates in children's has come down a little bit. Adults got a little bit way to go. But the support for those staff that are on long-term sick is in place, but the figures still remain high until some of those drop off.
And is that linked with the turnover? Because it looks there's 20% sickness and there's 19, so therefore near as damn it 20% turnover as well. So it seems that there is a big churn and then a big sickness. It's 1 in 5 people.
There's been a lot working in that directorate. There's been a lot of change. There's been a lot of change. I think we'll have some steadiness coming in with it. I think we've had a gap in terms of the new director coming in. I think there's been some uncertainty. I can't tell you whether that's linked or not to some of that turnover or sickness. I think there's been pockets of teams that have had significant sickness for a period of time, and they are changing. They'll come. You'll see. I think you probably will see a change at the next report in terms of some of those figures reducing in terms of the sickness absence. Hopefully the retention levels will improve also. I think it might just be a coincidence in terms of the amount, because if you drill down into individual teams, there'll be completely different reasons for some of that absence.
Thank you. Councillor Egg?
Yeah, I think I just was interested on that particular point. Do we map the reasons in different directorates? Because obviously we flagged up mental health and then musculoskeletal are probably the top two. I suspect, and I may be entirely wrong, but those musculoskeletal ones tend to be probably more in place, and it's the mental health and stress issues that are in adults. So are we making sure that we're doing that, so that we're targeting our sort of interventions in the right place to help deal with stress where it's stress and MSK where it's heavy lifting?
As far as I'm concerned, we do, don't we? I don't get involved with that.
In a word, yes, we do. The system we've got in place now for the symptoms absence reporting and the information that we get through means that we can then target we can look at the hotspots and make sure that we're getting referrals through for people with musculoskeletal when it needs to be that case, and we'll rapidly get people through for support for EAP or whatever that person might need to get them through the system of occupational health more quickly. So yes, in a word, we map it all through.
Thanks, Claire. Thank you. Councillor Corbyn?
Thanks, Chair. And I guess you can get musculoskeletal in adults as well, can't you, with people who are lifting who shouldn't be lifting. But when you find yourself in that situation, sometimes it's very hard not to. I just wanted to check, Councillor Woodson referred to 20% absence. It's 20 days, is it? Or is that a percentage? FTE days. FTE days. So it's not that we've got 1 in 5 off sick. Right, okay, thanks.
Thank you. And I think it's really good news as well to see that we're starting to do a bit more concerted work on the equalities aspect of trying to broaden the workforce. So I'd be really interested to see how that goes over the coming months. And I understand that the groups that you've set up for staff are being quite successful. Do you want to just say something about that, Hannah?
Yeah, the staff network groups have really taken off, to be quite honest. And what's been really pleasing from my perspective as well is these aren't owned by HR, they're owned by our employees, and it's every level of the organisation. It's not just senior managers coming forward, so I would say it's really is welcomed, and they're really keen getting involved in promoting, whether it be days or activities and things like that. So they really have been really quite self-generating and taking an interest, which is brilliant. And you've got employees interested where they might not necessarily just have a particular interest in from a protected characteristic, which is nice that people are sitting on other areas as well because of wider interests, which is really positive, and we're using them as consultation as well.
Great, thank you for that. And I'm not sure if this has been passed through to you yet, but I had a conversation with Laura Williams about the potential for thinking around veterans and families of service personnel, that there may be an opportunity for a network in that respect as well. I'd really like us to look into that under the Armed Forces Covenant would be, I think, quite a good move forward too.
there's no harm in any networks coming forward. We're quite encouraging it, actually. We've actually just really had a sole parent network that's just been set up, which has taken off a storm, to be quite honest, which is good, and it links to our affordability and things like that. So yeah, really good.
Brilliant, thank you. Councillor Corbett?
Thanks, and just really need to bring attention to the fact though that as you go higher up the grade structure, our diversity becomes less, doesn't it? So I know that the groups are self-organised and self-led. However, we really need to address the fact that people from all backgrounds aren't being promoted through the ranks. You know, that's the one that jumps out at me from these figures.
Thank you. Yes, yeah, Helen.
That's one thing that I've actually spoken to the consultant on directly, because that's one of the things that I said, this is the bit that we need to be getting more focused on. And it's not just about having the traditional ideas. I said, what do you know that's happening in other areas? How can we do it and make it happen? I know the NHS have done quite a lot of work around that. So there's quite a lot of live case studies around that. But you also do have to have the investments and resources around this. So it is about what can be practical. But yeah, that is actually one of the direct things I've asked.
Thank you. Thanks. Councillor Ray?
Sorry, Chair, it's just a thought that came to me. I'm not sure if we ever do this, but obviously with adult social care and in particular in customer communities, vast majority of the service we provided is not provided by council staff. Have we ever, or do we collect the similar data for large contracts that we commission, or even small? So I mean, thinking things like Explore, but also adult social care and the commission contracts?
Not that I'm aware of, no. Thank you. I'm just looking behind you. The answer is no.
Thank you. Right, okay, thank you for that, Helen. Very much appreciated. And for item number 6, the recommendations are on page 29. And so from memory, note the report and workforce profile provided in Annex A. So can I see those in favour of the report? Yeah, that's everybody. Thank you. So that is approved and noted. Right, item number 7, as we said, we're going to move that to the end of the agenda because that is the element that has the private information in that we will do in private session. We have on page 63, 64, the work plan there. Does anybody have any comments on that at all? Any thoughts, Helen?
Obviously, I haven't added on the additional report for March, so that will be added and brought on as well.
Okay, thank you. So that'll be updated to reflect what Ian asked us to consider in item number 5. Anybody else at all?
Then we'll need more meetings organising accordingly.
Yes, yeah, thank you. Right, and finally, urgent business. I've had nothing notified to me, so there is none on that. And before we go into private session, item number 7, Helen, do you think that you could just introduce it to give an overview, and then we will go into private session and we won't come back from that. So that will be the end of the meeting then. Thank you.
So this report just gives the committee with expenditure on redundancy, pension and exit discretions in accordance with our policy. We have 4 different business cases to look at, and these are all for information purposes. Just a reminder to the committee that the figures that are given, these may well vary because it's at the point of redundancy that obviously final figures, so they are indicative figures that the business case is associated on.
Thank you. And just for public information, the recommendation on this report is to note the expenditure associated with each proposal as detailed in the annexes. So that's what we will do in private session. And so I'd like to thank everybody for joining us today and public for watching. And please, if you wouldn't mind leaving and turning off the live stream, that would be great. Thank you. Thanks very much.